Hello, my name is Dr. James Shamia. I'm a pulmonary and critical care physician and also Senior Vice President and Chief Quality Officer at the University of Tennessee Medical Center. A week ago, we spent a little time with you to give a COVID-19 update and mentioned that we would try to do that about once a week as we were able. And so today I'm going to go through very much the same format I did a week ago and tell you our perception of the current COVID-19 situation, particularly from a hospital perspective. And unfortunately, what I'm going to be showing you shows that the situation has definitely worsened in the last week. This shows the new cases across all these counties each week, and you see on the far right-hand side that we've had a significant increase in the number of new cases diagnosed. I showed you this last week, and we've changed the states just a bit, but this is a group of southeastern states, and it shows the rate of cases being diagnosed. All of these states are similar in that they have relatively comparable vaccination rates. And so as you look over the far right-hand side, that's what we've all been experiencing in the last several weeks. We see that Arkansas and Missouri, for example, that are 3 to 4 weeks ahead of us in this current surge, are seemingly starting to level off. You see the orange line is Tennessee. It is still rapidly rising. You also see some other states, for example, specifically Mississippi, is rising at a rate even faster than Tennessee. This shows the hospital census on a daily basis across all these counties, across all the hospitals in those counties. So this is basically the number of patients that are in the hospital each day across the pandemic. And so when I was here with you a week ago, the census was 302 patients. And now that in just 1 week's time across all these hospitals has increased to 418. You also can see just how steep that line is on the right-hand side. And so this is some of the steepest hospitalization increase that we've seen at any point during the pandemic. At the current rate of growth, we would likely exceed that prior peak of 615 around August the 30th, and we would anticipate at this rate of growth, which again, I can't see into the future precisely, but at this rate of growth, we would see around Labor Day that number being around 741 patients in the hospital. I want to draw attention to the fact that today the Tennessee Hospital Association issued a statement detailing the significant challenges Tennessee is experiencing and the consequences we face in the very near future if we can't reduce the rate of hospital admissions. So then this is the specific data for our hospital, and I want to point out a few things. We have 99 patients in the hospital at the present time with COVID-19. Since I last showed you data 7 days ago, that's an increase in 26 patients. Since 30 days ago, that's an increase of 85 patients in the hospital, and the percentage of patients in the ICU is 29%. In the lower left, you see the vaccination status of those in the hospital. This is very comparable with what I showed you last week and also what state and national statistics are showing. So we have 90% not fully vaccinated in the hospital at this point. And probably the most significant thing I want to point out is in the lower right-hand side, where you see the average age of patients who are in acute care and very specifically in the ICU. In the ICU at this time, the average age is 47 years old. And to have an average of 47, that means that we've definitely seen patients in their 20s and 30s who are critically ill. The other thing that we're seeing this time is that some of those patients in ICU are really relatively or completely healthy. And so there's definitely a distinct difference with this wave of COVID-19 compared to prior. Made this point last week, and I just want to make it again. As the healthcare system gets busier and busier, it's so important that the right patients seek care in an emergency department, because we absolutely want patients, whether they have COVID-19 or another diagnosis, who need care to get care. And so this shows on the right-hand side all the things that are appropriate for emergency department. But remember, those things like walk-in clinics and urgent cares are able to take care of a lot of other needs. And so just wanted to point this out again. Some closing thoughts now. We spent time rounding in our hospital with our clinical staff and our nursing staff, and that's been on our COVID units and also on our non-COVID units. And I think at this point the term healthcare heroes has been used so much, it's probably starting to lose some of its meaning. But in this particular circumstance, it absolutely applies. And so in talking to our team, and particularly as we round on some of our COVID units and asking them, what can we do to help you? One universal theme is that the thing that's going to help them is just for this wave and this surge to end, and for it to end as quickly as possible. And so I want to remind everyone and get back to what are the steps to end this wave and end the pandemic. So these 5 core actions you've heard before, but we need to repeat them. First of all, certainly get vaccinated. And we've shown now 2 weeks in a row in our hospital data just how important vaccination is in preventing severe illness. But we can't forget all of these other actions that we've done for months that before we ever had a vaccine were quite effective. And I'm really talking to the individual or the individual household at this point. But just remember to keep that distance. If you're sick, stay home, wear face coverings, wash your hands regularly, and clean frequently touched surfaces. We can't not acknowledge that these actions have helped us before, and to help our healthcare team and to help as few people as possible experience the negative effects of COVID-19, we want everybody to be careful. And these are the ways to be careful. To wrap up, I do want to thank all of our healthcare providers across the community, not just in our health system, but at the other health systems, our providers with EMS, home health, post-acute care. Every aspect of healthcare has been affected by this, and we all owe you a deep debt of gratitude. And so as we're able, we'll try to continue to update you once a week, and thank you very much for your time.